Australia Award Fellowship is very helpful for us in the sense that it helped us to understand that how the evidence and the practices could be bridged together.
I am contributing to the antenatal care project. That project is about improving the adherence to nutritional guidelines for antenatal women so that we have better outcomes for women and children postnatally. The fellowship brought in focus towards some factors that otherwise we do not think about. For example, how to make it more sustainable later on.
This fellowship helped me to coordinate and to manage the project with a new outlook. For me, it was a very good opportunity.
Tribal populations, even they are living in the remote, or maybe they are inhabiting in the suburban areas, but they are not getting that service delivery. So we understood that this is the important place where we can implement. So I think this fellowship has given us that opportunity to go back to the field and analyze those problems. What is the change that has been happened in the problem itself?
We also learn many things from them, and we fulfill our gap. For example, language barrier.
So just want to imagine, what if there was no fellowship? We would have never got this opportunity to actually go and learn about what's happening in that region. Here we got to work with tribal women and then address their issues and also help them how to cope up with the challenges, and also provide them an intervention where they could actually utilize the facilities from the healthcare.
This project we are hands-on training on how to implement in rural and tribal or indigenous people. It is very helpful to us.
The evidence-based information, evidence-based studies, and after that the structured and step-by-step methods help us to identify first of all the gaps, and then to intervene or to implement what is the best practices in the field.
My team worked in type 2 diabetes, which I implemented in West Bengal. I have an opportunity to meet those people in tribal community. Actually, it is a great opportunity for me to meet JBI and the people.
Also, I think the fellowship also highlighted the leadership part, how we can be clinical leader. I expected learning, but what it turned out to be a learning, a lot of new exposure, networking, getting to know a lot of good souls.
I have learned a lot during this training program, going to the field, interacting with the members, learning the methodologies of JBI and PACES.
The fellowship program here is very important because was the most important thing that I liked here was the clinical health clinic that we visited, the Aboriginal health clinic, and it was a really learning experience for me. If something like that could be implemented in our place, that would be something great, I think. So that was a wonderful experience.
We are at the stage where we need to understand what is the problem for Aboriginals or the tribal. So I think this is the major highlight where I could understand that this is not the problem only for India, but also for Australia that needs to be addressed.
Through this fellowship program, I got the chance to come to Australia for 2 weeks and meet all of you, listen to you, your stories, and to meet the indigenous population from Australia also.
Continuous mentorship support was there throughout the 10 months, starting from my team and also from the JBI and the University of Adelaide. I have received a spontaneous response and mentorship support from them, which is a key highlight. And the people here are very much warm and very much humble.
Yeah, I enjoyed a lot in Adelaide, not only cultural experience, also the exchange of different opinions. I want to continue the networking of this mentorship and the knowledge platform for other projects in the days to come.
It is a learning from you, from all your JBI team members, that how to club or how to weave the this fun part, the fun element in your work.
I've enjoyed walking around the city. It's a beautiful place to be. beautiful people. I love talking to them, and I have loved sharing the different experiences altogether.
Kind of an introvert, so it's a difficult thing for me to break through and talk to people. So this has been a learning experience all through, and it is yet now even. So we are having so many networking events, so it has helping me come out of my cocoon slowly but steadily.